and welcome to Rajya Sabha Television. I'm Frank Rausen Pereira. With me is Eamon Murphy, Regional Director, Asia and the Pacific, UN AIDS. Welcome and thank you for joining me on Rajya Sabha Television. Firstly, what brings you to India and how has the experience been?
Well, I've come to India for two reasons. One, for some meetings at the national level. That's why I'm here in Delhi, both with government and also with the community. But then I'm going to Gujarat state for a couple of days because we have a joint UN project there in support of Gujarat state that I want to see firsthand now a year into the project how it's going.
So when you talk about these projects, do they have specific goals? Do they have specific, ends that you would like to meet through them? Tell us more about these projects.
We have a global strategy that brings together 11 UN agencies, and UNAIDS is the convening, the coordinating body that brings 11 different UN agencies. You've heard of the World Health Organization, the World Bank, UNICEF, UNDP, quite a number of them. So in India, we've taken a new approach across the region, and we're pooling the resources to collectively have action. In a country like India, little bits of money everywhere doesn't have the impact that you would by putting your money together. And in Gujarat, we're working with the local authorities and the community to look at models of response that could be applied in other states here in India, but also across the region. So it's a really exciting opportunity.
So a very focused action plan is what you're looking at, basically.
That's right.
Right. So as an organization, UNAIDS, what are your goals? What are your ambitions? What is it that you would like to achieve?
UNAIDS supports the countries across the world who've signed up to global targets on HIV and AIDS. And 2020 is the next period of targets, and that's only a year away. So our role is to bring together a whole range of partners, government, community at the national level, technical partners, donors, other agencies to work together against the national plans on HIV. And so that's our role is like a broker, a technical broker, resource broker, policy broker, advocacy, coordination, political support. And so this is the role that we undertake. And it varies between countries. Like here, the focus is on Gujarat and the national level, right? As well as some other work in Mumbai and other places that hasn't stopped across the country. But and it varies in different countries depending on the need.
So are there any particular organizations within the country that you target, that you would like to take on this battle against AIDS with? Or is it the governments that you work with? Or what is the model that you apply?
Well, it's a wide range of partners. Who is here? Who can speak for the people most at risk or affected by HIV? The government, through NACO, the National AIDS Control Authority organization, is an obvious partner, right? And so, and here, Prime Minister Modi has brought together TB and HIV and want them to work together. And you could add Hep C to that, of course, because by bringing the synergies of all three, you'll make more efficient, more effective response and save money and lives as you do it. So we're here to support that leadership. But then there's the AIDS Alliance, there's the people living with HIV networks, there's a whole range of partners. There's technical people looking at laws, there's people looking at prevention programs, the treatment specialists. India, of course, has given a great gift to the world in the form of the generic drugs for HIV, which has saved countless lives. And so we work with the manufacturing industry as required to support innovation, new treatments to help deal with the disease as it changes.
Talking about innovation and technology, what is your role and how far has technology come as far as dealing with this particular disease or problem is concerned?
Well, our societies are constantly evolving. Today, the main mode of transmission in Asia Pacific is the mobile phone. And when I'm at conferences and I hold this up after asking that question, people are puzzled. I'm not talking about using drugs, not talking about sex. I'm talking about how do young people communicate? How do they connect in society today? And most of our programs, like lots of government programs, are behind where the young are. So we have to catch up. We have to work with the young people on where are they at? How do they communicate? How do we get messages to them? Because across Asia and the Pacific, we're seeing new wave of second level infections. In the Philippines, over 200% increase in new infections in the last 9 years, the bulk of that in the last 4 years. And the main mode of transmission is the connection. How do these people meet? Why weren't they meeting and having high levels before? You can have a clan of over 1,000 young people using Twitter to communicate and meet. So we have to engage and innovate the programs. India needs to innovate to catch up with the modern technology, and of course you're a technology leader, so we need to harness that. But using the young people themselves who understand how they use it better than you or I.
So, talking about the young people and talking about technology and the advent of social media and so on and so forth, what are the challenges really in trying to address some of these problems, and what is the biggest roadblock that you encounter as an organization?
Collectively, there are two major roadblocks. One is complacency. Many countries have been doing well in the response to HIV and arresting a bit, right? And now we need them to re-accelerate the response, because that last mile, the new infections that are occurring are in new geographic areas. Like here, Mizoram is high again. It's a hot state in terms of HIV again, or new populations in different countries. And countries that thought that they were doing well are now seeing rising new infections. So we need to do that. Political leadership is critical. The resources. Here, the World Bank and the government have a 50-50% share project on prevention, which will end soon, and the government needs to pick that up. So the government will need to look at innovation in terms of its prevention program and re-stimulate and change that. There's a new technology called pre-exposure prophylaxis, or PrEP for short, which is basically taking the HIV medicine when you don't have HIV, and it builds up a resistance and it protects you from HIV when you can't use a condom. And stigma and discrimination is still the biggest barrier across the region to get young people to access services, to test, to use condoms or other prevention tools. So PrEP's a new way of getting around that, and so this is why we need countries to scale that up quickly. Australia's had 25% reduction in 1 year of introduction.
Since we're here and since we're talking about safer sex and so on and so forth, is there enough awareness as far as the general populace is concerned? How do we build that awareness? Who needs to take the responsibility of doing that?
We need that responsibility at national, but also at the provincial, the state level in India, and the city level. A couple of years ago I visited Mumbai, and the mayor of Mumbai was saying that didn't realise that HIV is still as much an issue as it was, because he didn't see the billboards that he used to see. But there's 12,000 new infections a year at least in Mumbai alone. So we need to see new prevention and new messaging out there, partly by the internet, right? That's the technology we need. Billboards are for the general population, and they're not always at risk. And it is concentrated epidemics. It's sexual transmission, either for those who use commercial sex workers, men who have sex with men, or injecting drug use. And so we need to target them. It's better to be more targeted in the communication, but we need a lot more of that communication to get to them, rather than the general population and worry them.
So is there a specific age group or a specific social grouping that is more susceptible to contract the virus?
Any age can, if you're engaged in the risk. And we're seeing pockets of older people who are now taking risks that they weren't taking before, right? But it's the young predominantly. When I talked to the Philippines significant increase in new infections, it's in the young, from as young as 13 to 24. 96% of those are under 24. So that's a significant new group. The older cohorts were the ones who were exposed to the messages in the past. The young ones are not seeing it or hearing it. So schools need to be part of that. We need to have that comprehensive sexuality education so they understand the issues, and it slows down sexual activity. It doesn't increase sexual activity. But India has done great reforms in law. Getting rid of 377 is a powerful message to many other countries, as well as to obviously the population of your own country.
We'll come to India in just a bit, but I would like to draw your attention to what you just spoke about. You said there is a dip in the number of cases that we've seen, say, maybe 20 years ago. Has that also made the administrations a bit complacent, do you think? And that's why we've suddenly seen that there are still this many cases.
Yeah, since 2016, we haven't seen much change in terms of a reduction of new infections in our region. And we're only 9% reduction in the last 9 years. And it was higher a couple of years ago. But because increasing infections are over tipping that balance, it's going down. So it really is complacency. Governments have stopped investing in the prevention side of the programs, and we can't treat our way out of this epidemic. So that's the most serious issue that we're now facing. An investment in the political commitment, not just the financial, which has to go with that, and the right programs. Not using the old programs. Innovation and refreshing the programs is critically needed.
Right, so I've got some numbers here as far as India is concerned. Let's talk about that now. The prevalence of AIDS in India is about 2.1%, which is down from around 0.4% in 2002. So what have we done over the last 2 decades or so to bring this number down drastically, to halve it for that matter?
Well, India was one of the first countries to really understand that it needed to work with the key populations and put the community at the forefront of the response. So you have what's called social contracting, where the government funds the local community groups, the key populations group, be they men who have sex with men groups, sex worker groups, drug user groups, or those who work with those groups to actually fund their own programs. And through the SACs, the State AIDS Control organisations, as well as at the national level. That's one of your big innovations. And that has been working well, but it needs that next re-acceleration to get to the next level. Plus increased treatment, which treatment is a bit slower than it needs to be, given that you're the major producer of generics. But that may be an obstacle of people accessing rather than availability.
What about the social stigma that is attached to it?
That's where part of that is. People in many of our countries in the region wait until they're so sick before they go to doctors and healthcare workers. Why? They're afraid of losing their jobs. They're afraid of the social stigma for them and their families. And children who don't have HIV but a member of their family does will be kicked out of schools. So that's the fear factor will hold people back from going into treatment. And the longer they delay, the less effective the treatment is for them. And it also poses a risk for further transmission. So we need people to test and treat the same day, but test early. And stigma is what holds people back. That could be stigma from community or healthcare workers.
There's not much information about treatment out there as far as HIV is concerned. So when we talk about treatment, what is the kind of treatment that is really available that people can have access to?
Well, we have modern multi-generational drugs compared to the old days, and now it's 1 pill a day, so it's quite easy to take, and the side effects have really gone away. So this message needs to get out that people need to understand to test early, and they're not going to have side effects. Some places people are afraid of side effects, but that's the old drugs. That's not the current generation drugs, and that's where India's been part of that innovation. But the messaging out there to get people to understand, you take the treatment as early as possible, you have the same life expectancy as someone without HIV.
So there has been, tremendous advancement as far as the treatment is concerned, is what you're suggesting. So let me go back to something that you were suggesting earlier. You mentioned about the Northeast, really a state in the Northeast where the prevalence rate is quite high. Why is that particular region? Do we have any research to suggest or to show us why the Northeast in India is far more susceptible to HIV/AIDS?
I don't have research to hand as to why that area. It was the early area that was affected, injecting drug use, the lack of programs in those days, the spread. But it's now sexual transmission. It's the main lead there. Like in Mizoram, the national prevalence is about 1.6% for sex work. Much, much higher in Mizoram for sex work or for drug use, the transmission in that. And that's why we always need to move past the national level to look at the states. So Mizoram and the Manipur, other states up there, Gujarat's one of the high states too, and it varies. And so Mizoram is an emerging epidemic, maybe because the programs weren't there, because the epidemic wasn't taking hold and strategic information wasn't out earlier. But I can only speculate on that.
Yeah.
The experts are here in country. India knows what to do, and it needs to have that energy to re-accelerate the programs in those states.
And what is the status of AIDS in the country even as we speak today? And there is this whole goal of eradicating AIDS come 2024. Are we in a position to achieve that goal?
Not yet. Not without a re-energized program. It's that last mile. We need to look at effectiveness and efficiency of the programs that are put in place. And so PrEP is critical. New forms of testing that are available will help get more people into treatment earlier. But PrEP will keep numbers of new infections down, and that's the goal, not just more people on treatment. So it can be done, but it will take new efforts and reinvigorated programming.
All right. And in all of this, what is the UN AIDS' role going to be in trying to allow India and the region as well to come out of this particular epidemic?
It's to get the message out there, but most importantly is to support the national partners. That's the government and the community and the technical partners to put in place the right programs. So we have to work with ministries of finance to get them to give the resources that the health ministries need, the education ministries need, whoever the partners, social welfare ministries need. But then it's leadership, political leadership at national and at state level and at city level. Critical. And so that's our job, is to try and mobilise, and we need the community voice to be strong. India's always been strong in the past with that, and that's why we work with all the partners to mobilise that collective effort.
Are there any best practices, any good models that we can replicate here in India and in the region that other countries have used to successfully deal with this problem?
Well, it's a two-way street. We bring countries to India to learn. Right? And there was Namibia was here. Botswana is going to come in and look at social contracting and the leadership role of the community. There are other countries, Vietnam, Thailand, that are doing great innovation that India can learn from, and India has gone back and forth. So the countries do share South-South learning between each other, because the best programs are in similar countries. No point going to see how they do it in Sydney, because the system is different to Mizoram, right? And the realities are so different. So it's important to learn from similar countries. But India has been doing that. But most importantly, also sharing that strong community leadership it's always had in its AIDS programs. But the Prime Minister wanting to bring TB and HIV together is critical. Universal health coverage is a goal for India, like many other countries. And unless we bring the vertical programs and bring them together and integrate where needed, we won't be successful with that. And it's got to be across the full spectrum. Prevention and treatment, not just treatment alone, and the community at the forefront. It's the people's health that matters at the end of the day.
Are governments willing to spend when it comes to something like this?
Not enough. And that's a challenge, because health as a whole is not as well resourced globally as it needs to be. And we've seen a decline in AIDS funding of over $1 billion in the last 8 years. So that's just indicative of health as a whole. And we know the resurgence of diseases like TB, multi-drug resistance, malaria, the same. We don't want HIV to follow that pattern, because successes have been good, but not enough to get control. And so that's why we need to make sure that this last path that they need to go needs to be at the right pace to achieve the results.
I came across something that I didn't understand too well, so I must ask you this about the 90-90-90 testing and treatment targets. Tell me something more about this.
These are global goals that countries signed up to. You need 90% of those living with HIV to be tested and know their results, and 90% of those to go into treatment, and 90% of those to have viral load suppression. Viral load suppression means that if you're adherent to your treatment and taking it regularly and carefully, then you can't pass on the virus. It's another form of prevention, treatment as a form of prevention, which is reinvigorating lives all over the world, because people are realizing they are no longer the risk factor that others think they are. But this is the 390 cascade, and then many countries like India have prevention in there as well, 90% coverage of prevention services. But that's are the collective goals, but we're not going to get there by 2020, and we hope 2025, 2030 for those countries that need it. But we need more energy, more leadership.
How far along the way are we in achieving that goal in India? I mean, are we at 70? Are we at, do you have those numbers?
That's a difficult one for me to say. You're 80% there?
Okay.
Yeah.
Okay.
That'd be a fair, because it depends how fast you go with the rest, right? So if it sounds too easy, people get complacent. So been doing well, but if there's only 1.4 million people on treatment, you're a long way from the treatment coverage, right, that's needed. So and so those obstacles, why are people not going into treatment, needs to be analysed, and that's at state and city level, not at national level, need to be looked at, and changes are made to the programs.
So a couple of personal questions. Now, you've been in this role for some time. So what is it that you've encountered that was most challenging in your role? And secondly, what is the end result as far as you are concerned that you would like to see?
Most challenging is that reduction in commitment and energy by many partners, be that the resources that have gone down in Asia Pacific, because people have left too quickly from the response, and the lack of domestic political leadership. For me, people will be living with HIV. What I want to see is the improvement in people's lives that the prevention tools and the treatment tools can give, and the rights they have to live a normal life like everybody else, regardless of what other issues are on in their life. And that's what motivates me every day to challenge and confront stigma and issues. When I bring up HIV, it not always an easy conversation with political leaders. So it's what motivates me. It's the rights of people to live their lives, but also enjoy health like everybody else.
And give us an anecdote or, something interesting that you've seen in your role, something that always comes to mind, something that you can always think of.
It's a family that was spending its own resources to try and deal with HIV without getting into treatment, because the father was afraid of losing his job. And when we were able to show him a way of getting treatment without everybody knowing about it and how simple it was, he could then stop spending the family resources and support his children through school. It was a personal victory because it was just one person, right? And to see how their lives changed, and how he could confront the issues and still protect his family along the path. And for whatever reason he had HIV, it was irrelevant. But that to me is one of the things that stand out as an achievement to see that personally.
Right, and before I let you go, a message that you would like to give out to people who are suffering from AIDS and to governments as well to try and be more serious about this particular issue.
We need the political leaders to stand up and talk about HIV and to put the resources, give the support to the programs that are already there. India has one of the strongest programs around, but it needs energy and air put back into it, and that means resources. To the people living with HIV, treatment is available, prevention tools are new, and they're simple. And people need to get tested early and get into treatment, and then they can live a normal life like everybody else. And HIV is not the death sentence it used to be.
All right, Eamon Murphy, pleasure having you on the program. Thank you for joining me on Rajya Sabha Television.
Thanks very much, Frank.
All right, with that, it's a wrap on this telecast. Thank you for watching. See you next time.